Welcome to the Get to the Root podcast, where we build your health from the ground up. At Root Functional Medicine, we're on a mission to bring sustainable and validated functional medicine to the world. As a team of doctors and dietitians, we are dedicated to treating gut health, hormones, autoimmune conditions, and metabolic health at the root cause through advanced testing, food as medicine, and telehealth programs. For years, we've been helping people get to the root of their health concerns. Now, we're here to share our knowledge so you can benefit too. Stay tuned and join us as we get to the root.
Hi, everyone, and welcome back to Get to the Root, where we uncover the real reasons behind your symptoms and share a new way forward in healthcare. I'm Dr. Erica Armstrong, and today we're talking about something that touches nearly every family I know, mental health, and how functional medicine offers a missing piece in the conversation. We all know that anxiety, depression, and burnout are at all-time highs. And while therapy and medication can be essential tools, what's often overlooked is how much your physical health, especially your gut, your hormones, and your inflammation levels, can directly impact your mental well-being. In functional medicine, we believe mental health isn't just in your head. It's also in your gut, it's in your immune system, it's in your mitochondria. And when we treat the whole person, we can help people not just cope, but heal. One of the things I'm most proud of at Root is how we collaborate with mental health counselors. Many of them refer patients to us because they know how powerful root cause medicine can be for their clients' outcomes. For example, a person may be doing everything right, they're showing up, they're doing the work, but something still feels off. What we find here is that there's often a physiological block that's keeping the brain from fully engaging in the healing process. Maybe it's undiagnosed insulin resistance, nutrient depletion, hormone imbalance, or gut inflammation or more. These are things that we can help identify and help correct. For example, we've worked with counselors whose clients were stuck in cycles of anxiety and panic attacks, only to discover through lab testing that they were severely deficient in magnesium or B vitamins, or they had sky-high cortisol from chronic stress that was never being addressed. When we give counselors the data they need, functional labs that look at the gut-brain axis, hormones, inflammation markers, they can make deeper progress with their clients. It unlocks the full potential of the therapeutic process. So let's break down some of the important things that we look at in functional medicine that affect mental health. Number one, the gut-brain connection. This is one of the most fascinating and under-discussed areas of mental health. Your gut and your brain are in constant communication via something called the vagus nerve, which is a long, wandering nerve that connects your brainstem to your heart, lungs, and digestive tract. It's like a two-way superhighway that carries signals from your gut to your brain and vice versa. In fact, about 80% of the vagus nerve's fibers run from the body to the brain, not the other way around. That means your gut is constantly informing your brain about what's happening inside your body, whether you're inflamed, stressed, or balanced and safe. When the vagus nerve is functioning well, it promotes calm, rest, digestion, and resilience. But when it's impaired, whether due to chronic stress, inflammation, trauma, or dysbiosis, it can contribute to symptoms like anxiety, fatigue, poor digestion, and even panic attacks. At Root, when we assess this vagal tone through signs in the microbiome, cortisol patterns, and overall nervous system balance, we also include tools in our programs to support vagus nerve health like breath work, singing or humming exercises, and even limbic system retraining, which helps reset the stress response from the top down. The mind-body loop is why treating mental health from a gut and nervous system perspective can be so effective. You're not just managing symptoms, you're rewiring the body's foundational feedback systems. And get this, about 90% of your body's serotonin, the feel-good neurotransmitter, is made in the gut, not the brain. Further, a 2017 meta-analysis published in General Psychiatry found that individuals with depression had significantly different gut microbiota compared to those without depression. Specifically, people with depression tended to have decreased levels of certain anti-inflammatory bacteria and increased levels of pro-inflammatory bacteria. This suggests a link between the gut microbiome and the development or progression of depression. So when we're testing the microbiome at Root, we're not just looking for digestive issues, we're looking for signs of neurotransmitter disruption, systemic inflammation, and imbalances that could be directly influencing how a person feels emotionally. how Root supports mental health through testing and personalized plans. So what do we actually do about this? At Root, when someone comes to us with anxiety, depression, brain fog, or burnout, we look under the hood. This might include doing a root cause panel to screen for nutrient deficiencies, inflammation, blood sugar imbalances, and thyroid dysfunction, hormone testing, especially in perimenopause or PCOS, where mood swings and anxiety can be driven by hormonal shifts, or in men looking at testosterone levels, microbiome testing to evaluate gut health, bacterial diversity, and inflammatory markers, cortisol and adrenal function testing to understand chronic stress patterns. But testing is just a start. First, knowing how to interpret this testing and translate that into actionable steps is an important part of what we do at Root. And then, one of the most powerful and often overlooked tools we offer is education. Included in every Root membership is access to our Root Education Library, which features self-paced courses designed to support healing. One of the most impactful for mental health is our course on limbic system retraining. If you've never heard of the limbic system, it's the part of your brain that processes emotions, memory, and stress responses. When someone has been stuck in a chronic illness, trauma, or burnout for a long time, the limbic system can get stuck in a heightened state, constantly looking for danger, triggering anxiety or fatigue, even when there's no real threat. Limbic system retraining uses gentle brain-based techniques like breathwork, visualization, and neuroplasticity exercises to help reset the nervous system and restore a sense of safety in the body. This is a critical step in recovery, especially for those who feel like they've tried everything else and nothing seems to stick. When the brain is in a chronic stress state, even the best diet or supplement plan may not fully optimize physical or mental health. When we combine limbic retraining with functional lab insights and personalized care, real transformation happens. A Root approach combines nutrition, gut health, correcting deficiencies, and calming the stress response. And our collaboration with counselors is key in that last part. With that, I'd like to welcome our guest. Today's guest is Amanda Larson, a master's limited psychologist and the founder of Holistic Counseling Center. Amanda brings a deeply integrative approach to mental health, blending traditional therapy with a whole person lens that considers physical, emotional, and environmental factors. We've also shared several mutual clients over the years. In this conversation, we'll explore how functional medicine can play a powerful role in improving mental health, what Amanda has seen in her own practice, and what it's like to partner with a functional medicine practice like Root to provide truly comprehensive care. Whether you're a practitioner or someone navigating your own mental health journey, this episode will offer insight into how the mind and body are deeply connected and how healing one can help heal the other. Welcome, Amanda. Thank you so much for being a guest on our podcast. I've truly enjoyed collaborating with you over the years. So for our audience, can you please describe how you first became interested in functional medicine?
Originally started with my own health journey. So back in 2019, I actually started seeing Root functional medicine myself because I was struggling with thyroid issues at that point in time. Also a history of infertility, gut issues, and nutrient deficiencies, among other things with my health. I was feeling tired and sick and just had a really hard time as well, losing weight at that point in time. So I started digging because my approach to my current physician, or the allopathic or conventional model, I felt like I was gaslit into believing that my symptoms were all in my head or everything looked normal, even though I wasn't feeling well or having these struggles with energy or mood or fertility. So I started digging on my own and reading, and landed upon functional medicine that really looks at root cause as to why these symptoms were presenting themselves. And then I started digging locally to who offered those services and landed upon Root. And it was very helpful. And I got a ton of answers as to what was going on with the systems within my body, because the mind and body are all interconnected. And I got more insight regarding my gut health, my hormone health, my nutrients that my body needed to flourish, and was really able to turn my life around in a lot of ways.
And then that was inspiring to you in your own profession, and you began to incorporate that. And can you talk a little bit about your journey and wanting to learn more? I know when we first met, you were doing some traditional counseling, and then you evolved and started this amazing holistic counseling center.
Yeah, even at that point in time, probably a couple years later, I also did more trauma training that also focuses more on root cause regarding nervous system and how the body also holds trauma. So there was that piece that was also aligning. And it really just, I think, seeing clients for as long as I did, doing kind of traditional talk therapy or cognitive behavioral therapy, as much as it has value in shifting thought patterns or beliefs about the self, right, and impacting behavior and emotion, I was working with people with really complex trauma, and it was just patterns of them getting stuck and just looping, especially when we talk about relational trauma and how the body will gravitate towards familiarity and play out those similar circumstances that they experienced early on in life. So it was a combination of both things, the trauma work with my own clients and then functional medicine, that really the mind and body and the spirit all being interconnected and how important that was for my own clients' healing. So I got more training in EMDR or somatic-based work, body-based work, as well as parts work here eventually over the last year. And then also diving deeper in nutrition and working and collaborating with your practice to do more under the hood type of work to see what else is going on. And it just came together. And it's been this really beautiful creation over the last few years.
When we were first starting practicing functional medicine, we actually saw how helpful EMDR could be for people. And a lot of clients who seek functional medicine do have a history of trauma. And so can you just explain a little bit more, what is EMDR and what does it stand for? And how do you incorporate that in your practice?
Yeah, so it was developed in the 1980s by Francine Shapiro. It's eye movement desensitization reprocessing. I know. It's a bilateral model, so meaning or like modality where we use eye movement or even tapping. Walking can also be utilized, or even auditory. Basically, we're activating the left and right hemispheres of the brain. And there's also different phasing to activate limbic system and prefrontal cortex. So it's memory reconsolidation or helping the system become more adaptive, because trauma isn't just what happened to you. It's how we didn't have support or resources at the point that those traumas occurred, and the body internalized through thought patterns or beliefs, or even physiologically how they experienced that at the point in time. So we call it dual awareness. They have one foot in the past and one foot in the present, and we're allowing the body to basically reprocess and receive what it didn't receive. So we're getting it unstuck from the system while also reshaping their beliefs about self and other people. So there's different phasing that you have to go through. But it is really cool to watch with clients who've experienced such chronic, even health issues, or struggling with being more in a sympathetic state, or even just struggles with disassociation, that it really shifts the nervous system. And when they think back to these memories, they're not as activating. They're not holding the sensations in their bodies anymore. And so I find that there's like kind of an art to it, because everybody's different. I think you know this in functional medicine. It just depends is my favorite statement. I might utilize EMDR, but also people aren't always ready for that. It can be really scary and overwhelming because I don't know exactly. I try to prepare them as best as possible, but I don't know when they're activated in that memory or target, how they're going to react to that. Like different parts that might come up that are very protective or physiologically could be very intense or overwhelming. And so I really try to do resourcing ahead of time to really prepare before we get started with EMDR. So those things would include like mindfulness or breath work, tapping or visualization of some sort, to have them available if they need them during the time that we're going through their history of traumatic experiences or targets they've identified. And then parts work has been beautiful to meld into that. So we do that before I get to EMDR to really know what are those protectors that might come up. So whether it's disassociation or avoidant parts that really manage and control the system. And so we do a lot of that work up front before we get to EMDR. But it's really the high correlation between people who've experienced some form of complex trauma and then the manifestation of an autoimmune condition later on, right? Because of the years that they've been stuck in nervous system dysregulation, whether it's fight or flight, that sympathetic state, or playing around with that dorsal vagal response too, where they oscillate between those ends of their nervous system, just that chronic stress on their bodies long term.
Yes. Thank you for making that connection to autoimmune conditions. That's one of the most common things we treat at Root. And you're exactly right that the brain and the cortisol response leads to a dysregulated immune system, especially if it's been chronic and unaddressed.
Mm-hmm.
What are some other ways that you've seen that functional medicine in particular could be helpful to your clients? And you're doing this fantastic work on the limbic system and the recognition that this is related to chronic illnesses.
Yeah. So my specialty is working a lot with complex trauma, which generally just means attachment, relational trauma that was really prolonged. So with that being said, in the manifestation of an autoimmune condition, functional medicine really helps as I address more of the trauma, stress management piece, or the just nervous system aspect, and compassion, all these other mindset pieces too that come along with it. You have to think of how chronic stress also impacts gut motility, absorption of nutrients, activation of your immune response, and how the trickle-down effect, maybe like gut imbalances and SIBO and all of these sorts of things that might come out. So then that makes it difficult for them to absorb nutrients. So then we might see nutrient deficiencies, which aren't uncommon. And then the hormonal imbalances, so blood sugar issues with cortisol, and then the sex hormones eventually getting impacted, or thyroid. One of my clients, because I'm through a holistic or integrative lens, first I create stability. The last thing they're in a space sometimes is to add more things to an already taxed nervous system, right? They're going to get really overwhelmed or overstimulated. So I focus on a little more stability emotionally, really resourcing, helping bring maybe things down a little bit, and then talking about some of the other symptoms that are presenting. So even if there is struggles with mood instability, depression, anxiety, irritability, fatigue issues, which is not uncommon, chronic fatigue, discussing how hormones, nutrients, and gut health all impact to their functioning. So I always say what we do to body impacts brain. So, we talk about neuroinflammation. And so that's how I approach it. So I think of it like tier one is like we stabilize client, help bring things down, maybe do some deeper work. And then the latter being, all right, now let's address these other things that could also be playing a role too.
Yes.
Right?
The gut-brain connection, what happens with stress and affecting those nutrients and not being absorbed. And now we have very important nutrients that are important for the brain in return, especially like omega-3s and zinc and vitamin D and magnesium, the B vitamins, maybe not being absorbed because of this impact that stress and trauma has had on the body. Yet we need those nutrients to heal. And so that's why this collaboration is so ideal, because we have to take care of both aspects for true healing. Along that line, we're talking a little bit about the gut and how stress can impact it. And you mentioned motility. And 70% of the immune system lives in the gut. And that's where the inflammation is coming from. And you mentioned the neuroinflammation. And in functional medicine, we often see some symptoms like mood symptoms, depression, anxiety, actually being inflammation driven, or at least a big part of it. Mm-hmm. And so I know that we've been in a partnership, and your practice can actually work with Root in order to have us assist in ordering and interpreting functional lab testing and stool testing. How have you seen having that data and information be helpful in your client's health journey? And mental health journey as well?
I think it's very important just in general for health. I don't think the body's one. So I think to really optimize someone's health, we need to really look at what's going on within all these systems. I think gut health is really the epicenter of disease. Obviously, like trauma and chronic stress impact gut health. But if we optimize gut, yes, we'll see some often reduction in a lot of these struggles with mood, fatigue, etc. I also think of gut's impact on the nutrient absorption and also like hormones and metabolization of that and toxins, all the things run through that. In regards to lab testing, I have integrated that model within the practice because if we're really going to obtain more homeostasis or optimal functioning, we need to know and optimize gut health or these other aspects too of one's health.
You also mentioned blood sugar balance, which is another big thing we help with at Root. And if your blood sugar is unstable, you're going to feel anxious and sweaty and your cortisol is going to be high. But what are some other ways that you've seen, like how the foods you eat affect your mood, and how have you seen that play out in your practice?
I'm sure you run into this. I think Americans might struggle with, and there's confusion, I think, nutritionally, what is, I don't know, optimal for one's body, but obviously there's nuance to that and personalization. But I do think the standardized American diet really isn't the best in regards to stabilizing blood sugar, giving the body the nutrients it needs or nourishment in order to function. With that being said, I do believe in balance, having conversations around the importance of meal timing, right? And balanced meals in order to regulate blood sugar, because sometimes if there is blood sugar imbalances, it is increasing some of my clients' anxiety levels or even depression, where they feel really lethargic, or sometimes panic attacks can ensue if blood sugar levels drop and cortisol spikes to compensate for that. So I have conversations about what does diet look like. So I think it's really a complex issue just in general, like what is accessibility to one's food supply? Can we start small and work with them? So like nutrition education, super important. And then just talking about how key nutrients are really important, or fiber being really important for fueling good gut bacteria, or the importance of amino acids for every cell in the body. So just really more the nutritional education piece. I can only say so much with my training. Otherwise, I defer to you having dietitians. My role is more of the education piece. And then I defer if there needs to be more done with like meal planning and those sorts of things with clients. Yeah.
Yes, the doctors at Root have a similar relationship with our amazing dietitians, and most medical doctors have limited nutrition training. Ours have much more so than most because of the functional medicine training, but still having that dietitian resource is invaluable, and I'm glad we can support you in that same way that they support us too. Yeah, and just to shift gears a little bit, mindset is such a big part of healing too. And I know you work a lot with mindset with your clients. How do you approach that? How do you help someone change their mindset so that their body is ready to heal?
Depends. And I say that because most of the clients that I do work with, when you think about a negative core belief, it's not like it came out of nowhere. Generally, it's like there is evidence to support maybe I'm not good enough, or I'm bad, or I'm unlovable, for example, given their lived experience. So the brain learns this is how we see ourselves and others. So whether it's through EMDR, we really start to shift those core beliefs. So we're using bilateral, and first phasing being we want to desensitize the memory first. So it'll be neutral or distant. And then the next phasing being we're going to learn to shift. That one seems easier to digest with beliefs. I say that because if you've had multiple traumas, for example, that it might be pretty solidified that I don't believe that I'm enough or don't matter, for example. And so we have to go through multiple memories in order to really start to shift a lot of that. So sometimes it's easier to work with I'm learning that I'm good enough, or I'm learning that I matter. So that's some of the work that I do. Otherwise, self-compassion is also super important. I'm sure you see this with your patients. There can be parts of ourselves that are a little more critical or perfectionistic, right?
Yeah.
And those can be really helpful and adaptive to survive certain circumstances throughout our lives. There's no bad part of us in IFS terminology. All of them play a role to keep you safe in some way. And so I think that's also been really helpful with mindset, to give yourself a little more grace or compassion and really get curious about how your different aspects of yourself that might step in are really helpful versus shameful. So trauma does create a lot of shame. So it's twofold, working on those negative core beliefs there. And then also I think parts work is really lovely to reduce shame too. If we were to go more cognitive behavioral, some reframing, right? So I might work with clients and how we reframe, or maybe balance with DBT work, dialectical behavioral therapy, the combination of we can accept the reality as it is, while also we can make changes, and do better and try harder in some ways. So with all my training, it's a multi approach to changing mindset. So I can change it like literal, like with neuroplasticity with EMDR, and also neuroplasticity in all these other ways repeatedly. But it does take time.
Yes.
So that also is the tricky part. And then it just depends on the client and what might land a little bit better for them.
Yes. A lot of important points you just made. Yes, you can change the brain. The brain loves patterns and it doesn't like change because change is scary, and the brain main job is to keep you safe. And change isn't one of those things that's often thought of as safe by the brain.
Right.
But neuroplasticity, meaning you can reshape the brain just like you can train any muscle. But also you said it takes time. And if you've had one pattern created over many, many years, to create a brand new brain pattern and get your brain to choose to go down that one is going to take a lot of repetition and sometimes weeks or months. What would you say has been your experience, and like how long does it take to get someone's brain patterns to eventually change? And I know you're going to say it depends, and I totally agree with that.
Because when the client's coming in, I think that's the struggle. And I feel for them. And I've been there. Like, you want change to happen right away. You don't want to feel this way anymore. Like, you're tired of feeling like tired all the time and sit and get it on one front. And I think in general, we want that instant gratification anyway. But I also upfront am very real with my clients. This is going to take time. It could even take years. I remind them they didn't get to this place in their health overnight. So even then, it's like we have to be really realistic. We're going to have some setbacks, whether that's in your health journey, whether mental health or physical health. And so I'm really honest with them about that. So I think it just depends on the person. Some of my clients who you've referred, it's a much quicker route. It's not as complex, let's say, of a trauma history. So we can go through EMDR much quicker and they respond really well, or other somatic work. And then there are my clients who have ACE scores that are 9s and 10s. And so it's going to take like years. Not that's everything, by the way, but it's going to take years sometimes to really work through some of these things.
Yes. We've shared so much insight. What kind of tools or habits have been the most helpful for mental health for either you or your clients?
For me personally, it's changed my life around, and I wouldn't even be, I guess, without even your help or even developing this practice without implementing lifestyle medicine. And I do think it's super valuable, and it does take time to really implement and be consistent with it. But just in my own health journey, how important making nutritional changes was to my own healing, what nutrients or supplementation I needed to my body to thrive, whether it was through genetic testing that we've done to see what my body would respond best to nutritionally. Strength training and movement has been very powerful for either my nervous system regulation or just overall strength and metabolic health. Stress management's huge for me. I don't know about you. I'm trying to be better about boundaries and not do it all. And that's always a battle. And I think, too, just clients struggling with that. And there's just so much confusion. And I think you run into this, too. We get in these dogmas, and it's this camp or this camp. But it just depends on where you are in your journey, where a certain protocol could be helpful then, but maybe not now. And I think the biggest takeaway for me or even my clients is let's work with your body, not against your body. So there are times even in nutritionally or movement, I'm not going to overdo it when stress is high, for example. So there's this finesse to it a little bit. But even with my clients, I'm like, give yourself a little grace here. We can slowly implement some of these things. And there'll be seasons of life where maybe, let's say, an anti-inflammatory diet is going to be more helpful, but that's not maybe a necessarily sustainable approach for you long term. And the empowerment that people feel with these successes and actually realizing I didn't the 180 in their health too, and mental health. I didn't realize I could feel so good.
Yes.
It's like
We hear
night
that
and
a lot, actually, that people start to think that's their normal and they're just going to have to get used to feeling like that. But
Yeah.
it's so not true because we've seen the opposite so many times. And I'm sure you have too.
Yeah. And even times. I think you get to a place where maybe you optimize your gut health, right? And you feel good for a little while, but maybe something else happens because we're always exposed to something, stress, toxins, etc. So I think also like it depends on the season and going with that and adjusting as needed. And so I've had to do that throughout the years as well. And I explain that to clients too. So hopefully that was helpful and answered the question.
Yes, absolutely. And health is a journey. And having someone on your healthcare team like you is very important in navigating those ups and downs, and also having the right data so that you can make informed decisions on where you're at in your journey, what would be most helpful for you, because it can get overwhelming to have lots and lots of advice out there. And like, where do you start? And having a great counselor, knowing what exact nutrient deficiencies could be helpful in your healing, or knowing actually what's going on in your gut. And Amanda, where can people find you?
The Holistic Counseling Center, gr.com, or our handle on Instagram is the Holistic Counseling Center, gr as well.
Awesome. Thanks so much for visiting with us, Amanda.
Thank you. Appreciate it.
If you're a counselor listening, know that you don't have to carry the full weight of your client's healing alone. And if you're someone who's been struggling with your mental health despite trying everything, there may be more answers available than you think. Mental health is whole person health. And when we support the body, we free the mind to heal. Thanks for tuning in today. If you found this episode helpful, share it with a friend, your therapist, or someone in your HR department who wants to support employee mental health in a deeper, more effective way. Until next time, stay curious and take care of your body. Your brain will thank you.
Thanks for tuning in to the Get to the Root podcast. If you found value in today's episode, don't forget to subscribe, share it with someone who might benefit, and leave us a review. For more resources and to connect with us, visit rootfunctionalmedicine.com. Remember, your health journey starts with understanding the root cause. Join us next time.